I am here to express my deep concerns about the proposed staff reductions to Adult Protective Services. I have been working in the local senior nonprofit sector for the last 25 years. APS has been a vital partner and the final safety net for those of us who work with seniors who rely on them every day. At Alliance on Aging, we have contact with many clients through our Medicare, peer counseling, tax, ombudsman outreach, and luncheon programs. In the process of delivering these services, we learn about circumstances that may be placing the senior at risk of immediate harm. We receive calls from frantic family members, concerned neighbors, and friends of seniors with reports of suspected physical, sexual, and emotional abuse, self-neglect, financial exploitation, hoarders, seniors living in squalor, some with debilitating and serious medical conditions. Most often, these seniors are isolated, living alone, or sometimes with family members or caregivers that are perpetuating the abuse. Since we moved our main office to Old Town Salinas 6 years ago, we are more accessible to the homeless who stop by to visit in our office. Many are seniors who have complicated needs and require more than we can give them. They are often at a crisis point and are angry, frustrated, and become hostile. They are in need of assessment and many times some kind of crisis management. In all of these cases, we call APS or refer our callers to them for discussion, direction, and immediate intervention when necessary. APS is already stretched, serving a large number of seniors in crisis of some kind. Reducing their staff in half would severely limit their ability to do critical and life-saving intervention. Their ability to investigate financial abuse and self-neglect would be severely reduced, and that is often the cause of homelessness. The Public Guardian's Office has been limited for a long time in its ability to respond to these situations. Law enforcement has not consistently been able to follow up on financial abuse reports. APS has always been the safety net when others are not. You know the demographics. By the year 2020, 20% of seniors, 1/5 of our local population, will be over the age of 60. But they are not a group to be considered in isolation. They are part of the larger family. And when they are served, the entire family is served. If reductions in the county budget are necessary or inevitable, please consider seniors a priority and implement those cuts with fairness and equity for all age groups. Thank you.
Honorable members of the Board of Supervisors, my name is Cynthia Healy. I come to you as a privileged private citizen of Monterey who has had the opportunity to work with Adult Protective Services for the last 20 years. It is my understanding that the board is considering a cut of up to 1/2 of the social work staff of Adult Protective Services. It is my hope to present to you additional information this morning that will encourage you to prevent such a cut from happening. I've been in Monterey County practicing as a CPA for 24 years. I am a private trustee. I am also a certified fraud examiner. My mission for the last 15 years has been to be a strong and vocal advocate for seniors. I am a lecturer throughout the state of California in prevention of financial elder abuse. I am also a volunteer on the County Financial Specialist Abuse Team, also known as FAST, which Travis mentioned earlier. My licenses have enabled me to work closely with Adult Protective Services and the District Attorney's Office in the prosecution of crimes against seniors. Professionally, I've had the privilege to work closely with the exceptionally dedicated social workers employed by APS. I have watched these men and women over 20 years tirelessly work in the protection and care of senior citizens and disabled adults. I have watched the quality of the lives of seniors substantially strengthened by their efforts. As a private trustee, I have also witnessed with APS the painful removal of seniors from unsafe living conditions to placement in facilities where they are safe and cared for. That in itself is a very traumatic event to watch a senior who's lost mental capacity removed from their home because they are actually harming themselves by remaining there. The people of APS have been absolutely wonderful in their support and care and dedication to the seniors and disabled adults here in our county. At present, there are no alternatives for seniors to receive help when they are in a situation of financial abuse. Due to prior budget cuts, the Public Guardian's Office no longer easily accepts cases of senior self-neglect and financial abuse. By the time law enforcement or the Public Guardian's Office steps in, the seniors' assets have been depleted and the criminals are long gone. As a private trustee and senior advocate, I receive an average of 3 calls a week from Monterey County residents to inform me of situations of financial abuse and asking who they should call for help. Law enforcement does not have the training or resources to investigate each and every call regarding senior abuse.
Thank you. That's your wrap up.
A reduction in funding would only serve to increase the crimes against seniors. It is projected that Monterey County will receive 2,060 APS referrals in 2018. This represents a 20% increase over 2017.
Good morning, Board. My name is Salinas. I've been at APS for approximately 20 years in this county. Adult Protective Services serves seniors and persons over the age of 18 who are living with a variety of disabilities, including developmental delays, autism, young disabled veterans, senior veterans, stroke and accident victims, families and seniors struggling with Alzheimer's disease, and the ever-increasing homeless population who are over 65. APS workers work tirelessly to keep seniors in their homes and to prevent them from ending up on the street. These are the people who built this community. They deserve our commitment to excellence. There is a proposal on the table to cut APS social workers by 50%. That would leave 4 trained social workers to cover all of Monterey County to investigate cases of abuse, be it physical, sexual, financial, isolation, deprivation, and neglect. These cases often require days, weeks, and months of work to resolve. Social workers also train community partners on prevention and abuse reporting and work with law enforcement and the district attorney's office to prosecute the criminals who prey on the vulnerable in our community.
I'm having some trouble with the connection.
APS is often the only safety net for these adult members of our society. And I ask you to think long and hard before you chop a hole in that net. Think about who's going to fall through there.
My mother came to the attention of Adult Protective Services in October 2016. For the prior 6 years, my mother, a retired RN, had been living with an ex-husband who had systematically isolated her from her children and family, robbed her of her life savings, and neglected her. Attempts to check on her were denied, and hateful messages were relayed that she didn't want her family involved. At the time of APS intervention, my mother was found wandering and crying in front of her home. My mother was found to have advanced dementia, and she had not been bathed in a year. She was 25 pounds underweight, had feces caked under her fingernails and on her skin. Her toenails had grown over her toes, and her teeth were so decayed that her dentures no longer fit. She had not been to a doctor in years. APS helped make my mom safe. They monitored my mother's safety while I located a rental to move my family and accommodate my mom. They helped me to obtain medical equipment such as a shower chair and a wheelchair and grab bars. They assisted in getting my mother Medi-Cal and a primary care physician, a hearing specialist, and a podiatrist. They assisted me in getting in-home support services so that my mother could be provided for with 24-hour supervision while I worked. They supported me in coordinating the move from her abuser's home to my home and helped support me in the transition of moving this very frightened and confused senior to a family that she didn't remember. It has now been 16 months. My mother is happy, she's healthier, and she knows she's loved. Without APS intervention, my mother would not have survived much longer in that home. If APS positions are cut, vulnerable seniors like my mom will be left. They'll be the lowest priority cases. Her abuser depended on her remaining unseen. Please don't let this happen.
Just wanted to express and remind you, excuse me, that the mission of the Department of Social Services is to promote the social and economic self-reliance of each individual and family we serve through different services, including protective services to dependent and disabled adults and seniors, such as the aging homeless community, retired veterans, and ever-growing multicultural community. As you have heard already, APS values the quality of life of all diverse individuals we serve in the community, and it strives for quality customer service to the public and to our partners we collaborate with daily, whether it is with law enforcement, hospitals, or other public and private agencies. You heard today the perspective of a caring and working social worker who has dedicated decades of service to the most vulnerable adults. You have specifically heard a heartfelt story of just one of the many people we serve in our community. To all the supervisors today, I ask that you reflect on your own values and changes you'd like to see in the community. And think about how Adult Protective Services has and will continue to serve your constituents. Thank you.
I'm a professional caregiver. I just left Saratoga 2 hours ago. I came down. I worked a 15-hour shift. I'm a professional caregiver for 35 years. U.S. Army medic for 11 years and 7 months. So I've been in these homes, these nursing homes, these residential care facilities, and board care facilities. I know what it's like out there. I'm a professional caregiver. So I ask you guys not to cut, I'll make it short, do not cut CPS, do not cut Adult Protective Services, do not cut our social workers, they're working hard for us. My mother's here from New York City for 20 years. She lived in my home, residential care facility. I never placed her in a nursing home, never. She had Alzheimer's and dementia. She died of a bladder infection, a simple bladder infection. She became septic and passed away 6 years ago. So I'm a caregiver for my mother. I'm a professional caregiver out in the field, San Benito County, Santa Clara counties, Monterey County. I worked here. I work in these hospitals. I'm a retired emergency room technician. So I have a lot of experience, guys. So I'm asking you guys, do not cut the budget for social workers. Do not cut the budget for adult protective services. Do not cut the budget for child protective services. And please, look into our shelter. Our water shelter is closing at the end of the month. Please do not let that shelter shut down. I'm asking you. I'm an advocate. I'm an activist for the homeless and poor. I live in Salinas. I'm a Monterey County resident. Thank you.
My name is Karen Morgan, and I'm a resident of Carmel and an employee of Monterey County Public Health Laboratory. Today I'd like to request and speak to you concerning the proposed cuts in the public health and water laboratories and also in public health nursing staffing. And I want to know if you would please consider seriously approving the augmentation funding to keep the laboratory and public health nurses staffing levels at least where they are at this time. I wanted to speak and explain to you the close collaboration between the lab and public health lab and public health nurses. I am a microbiologist, as I said, and I work in the TB laboratory. We perform TB testing for local hospital laboratories because their labs are not equipped to handle the highly contagious nature of TB. Our methods are very rapid and accurate because they're based on molecular testing. We can phone and fax results immediately to the TB unit nurses in the community or in the hospitals. Throughout the culture process, private labs will only give you the results at the end of the testing period. TB patients can develop resistance to TB drugs. Our lab tests the TB cultures to determine which drugs are effective. And then if you go down lower on this first slide, I've given you slides and perhaps you can peruse them later. But the TB county TB nurses collect patient specimens, bring them into the lab for testing. The lab reports results by phone and computer at each step of the culture. This allows the nurses to monitor the patient's care in real time and also ensure that TB patients can stay on their medications and also will reduce the amount of the spread of TB. The next slide. There's a great increase in TB cases in the last 2 years. In 2018, based on the first quarter, shows we have over 25% increase above 2017. We should have about 800 TB cultures by the end of this year at the rate we're going. Each TB positive patient can generate 25 to 30 cultures before they clear of TB. This is a huge nursing and laboratory workload, over 4 to 6 months per each patient. And this is at a time when we're facing quite drastic cuts to our staffing. The effects of the proposed lab and TB nursing staffing cuts will mean that the inability to produce timely results to nursing staff and to physicians. But there's a cost of $18,000 per patient and to care for a TB patient, and if we have delayed results, they may spread the disease to their friends and neighbors, and you would end up having an exponential increase in cost to the county. Thank you.
Hi, Wes White, Salinas resident, community enthusiast at large. You know, it just breaks my heart every time I hear things like the APS, we're going to, cut half their services. The Nativity Medical Center, when they came in as a union, talking about how they're not getting, and they're doing these jobs that they're not really supposed to. They're not really trained, or it's appropriate for them to do so. It's just weird how we always have fun when you spend for these large hundreds of millions of dollars for projects, yet we can't take care of our main function, which is supposed to be taking care of people. And it just seems like we have a strange set of priorities. We make rules so we can break them, and then catch ourselves breaking them, and then make another rule, but those people just kind of get away with whatever they're going to do. I guess I think about pension spiking in that respect. It's just goofy. So now we have all these pensions we're going to pay overcharge for because of all that pension spiking and baby boomer stuff, and who's going to take care of who, and exorbitant rates and cost and charge. I think we get charged too much, and we don't really take care of people. I don't even think we're interested in taking care of people more than half the time. It seems like it's just business. Well, there's too much of an avalanche to try to resist it, so just let it go. And you see these arms and branches getting cut off, and these beautiful moments, these heroic moments, and those aren't honored and respected more than these overpriced buildings. You know, that cost hundreds of millions of dollars, that we're overcharged for consultants and construction and all these trades for union rates, which then we don't even treat our union workers well. So what are we doing? We're going around and around trying to take advantage of everybody. It's just not fair. We need to start taking care of people, treating people well, and that's the way our budget needs to go. That's the priority that needs to happen. We need to do a lot better and start taking care of our own.